Hi guys, my name is Minhal Bandhali. I'm one of the physiotherapists at London Back Pain Clinic, and today I've got a very good friend, guest of mine, Mr. Jonathan Hobbs. He's a acupuncturist, very renowned acupuncturist in the UK. He's also a physiotherapist. The reason why I brought Mr. Hobbs in today into our practice is that we get a lot of questions in the clinics asking about acupuncture. What is acupuncture? What acupuncture does? Is it safe? And today, hopefully, we can answer all the questions that the patients normally ask with their expertise advice from Mr. Jonathan Hobbs. So,
Thank- Thanks, Minhal. I'll just explain who I am and what I do, basically. So I've been a physio for nearly 30 years, practiced acupuncture and dry needling for 25 of those. I worked in the NHS, the private sector, professional sport. I teach these days a lot for a lot of different organisations. So if you've had acupuncture in the NHS or private sector, I've taught a lot of physios in that environment or in those environments. I teach for UKSI, which are the physios who support Team GB. I teach for a lot of physios in the Premiership, also in the MOD. So I teach physios in the Army and the Air Force and the Navy. I also teach specialist organisations like the English National Ballet. I teach their physios acupuncture. Also, in other countries as well, in the US, I teach for the NFL and the US military as well. So I teach a lot of acupuncture and dry needling, two terms you might have heard, for the treatment of all manner of problems. So we're just going to be chatting today about a few of those problems and how acupuncture works and why it might be a good idea for you to have it for certain conditions and what your clinician's thinking when they're referring you for it or they're suggesting that you have it. People have a lot of different ideas about acupuncture, but when your physio's doing it, there's a certain way that we think about it. So acupuncture is essentially the inserting of very fine small needles into areas of the body to create effect to help with the treatment of certain conditions. So there are 5 main reasons why your physio or your clinician might want to perform acupuncture on you. And these are based on the physiological responses that the body has when you have a problem. So the first reason is where we put the needle, there'll be a little response that creates a release of chemicals, and you get an increase in circulation, and this can help with healing certain conditions. The second reason is we also get a release of the body's own pain-killing chemicals, which help reduce down the pain in that area. The third reason is that if the muscles are very tight, we can insert a needle into the muscle and increase the range of movement and help reduce pain and increase flexibility to allow you to do your exercises. So when you're advising the patient to do exercises for back pain, should we say, which I know the clinic specialises in a lot of back pain treatments, that we can use needling into the muscle to increase the range of movement to allow you to access the exercise a little bit better, and that helps resolve the problem. The fourth reason is where the needle's inserted into the muscle has nerve endings in it which pick up the sensation of the needle being there and send a message to the spine, and this causes a chemical release that helps block pain. And then the fifth reason, that signal carries on up to the brain, and when it gets there, it causes a release of chemicals through the body that help reduce pain and help you feel better and reduce inflammation as well. So there's nothing magical about it. It's all very medical. It's all very scientific, and it relates to the body's own chemistry and how it responds to things. There's nothing on the needle, so you're not being injected with anything, but it triggers a response that the body has to help it heal itself and reduce pain, basically.
so great explanation, by the way. Can I ask you a question? So, for example, if I wanted to sum that up, let's say a patient asked me, what does acupuncture do? How would I sum that up to our patients so they know, okay, cool.
You can sum that up by saying that basically if you've got pain or restricted range of movement, then acupuncture can be useful for those things. And it works by triggering the body's own responses to help with its own level of healing and analgesia, which is painkillers, really.
Right. There's different size acupuncture needles as well. You know, you get small ones, you get thicker ones, you get longer ones. What's the difference between all of these ones, all these needles?
So basically, depending on the techniques that we do, depends on the length of the needle. So if we need to needle a muscle that's a little bit deeper in, so we have layers of tissue. So we have 5 layers of tissue. We have skin, adipose tissue, which is the sort of fatty tissue under the skin. And we have the connective tissue, which is like the fibrous tissue that holds everything together. Then we have the muscle, then we have the bone. So if we're putting the needle in the muscle, we may have to go in a little deeper depending on where we are, which means that we need a slightly longer needle to reach that muscle. because that's where we get our best effect from, is putting the needle in the muscle. So if somebody's bigger or taller, we might need a bigger needle. If we're going into a smaller structure, like the hand, which is more bony, we might need a much smaller needle. Typically, the longer the needle, the thicker it gets, and the shorter the needle, the thinner it gets. But when we're talking about a needle being thick, we're actually only talking about 0.3 millimeters, so less than a third of a millimeter thick. So you could take that needle and you could put it inside a hypodermic injection needle. It's that thin.
Oh, does it hurt?
No, if you're a skilled clinician, and which you are, and
Sometimes.
yeah, and you've got the right sort of training and practice, we can put needles in without anyone feeling. It's something that I do when I teach at a medical school and I teach doctors. They always expect the needle to hurt because they're so used to injecting. And I actually demonstrate on myself that I'll put a needle in, and I put it in without feeling. If it hurt, I wouldn't do it to myself. Yeah, it's incredibly safe. When we look at the research, when we look at the evidence, what we notice is that for a invasive medical procedure, it's incredibly safe, particularly when carried out in skilled hands, which your clinician will be. So with the right training and with the right experience and background, it's incredibly safe. Of course, it is invasive, so we are putting needles in, but because we understand the anatomy and the locations of these points, and there's nothing random about the procedures at all, it's incredibly safe, and the evidence bears that out. So, if we look historically, traditional acupuncture goes back 2,000 years plus, and typically, what a practitioner would do is put needles anywhere in the body to treat all sorts of things. Now, what we tend to practice as physios or doctors do is a thing we call Western medical acupuncture. So, Western medical acupuncture really is what we think of as reverse engineered Chinese acupuncture. So, we take traditional acupuncture and we look at the points and the techniques and so on. And then we look at the physiological mechanisms and the research behind any of those treatments to look at how we can medicalize it. So there's no Chinese physiology, Western physiology. There's only physiology, which is how your body works. So typically what you'll see with traditional acupuncture is a slightly different explanation for how people needle. And they might needle in all areas of the body that might seem to the patient a little bit random. And in the traditional practitioner's mind and in their training, there's a reason for that. As physios, we will tend to go closer and more direct to the problem, which is why if we're needling the shoulder, we'll go straight to the shoulder as opposed to down the leg. But what we might do also, based on those mechanisms that I talked about before, is we might come down the arm as well and just follow the nerve structures, the peripheral nerves down the arm, because the nerves that go to the shoulder that cause shoulder pain will also run down the arm. So typically in the world of physio, we might needle around the structure, but then we might come down the same limb and might needle down into the hand to influence the nerves down here that also affect the shoulder. So Western medical acupuncture is going to be following more of the muscles and the nerves, and traditional acupuncture, traditional Chinese acupuncture, is going to be following more of what they would call meridians, which is these concepts of channels that run around the body. So in traditional acupuncture, they might treat a shoulder by needling the shoulder and the leg, but in Western medical acupuncture, we might needle the shoulder and the arm.
Oh, perfect. Good explanation. So now we're going to stick some needles in someone. I'm going to get one of my colleagues, and you're going to show us how deep the needle goes in and how it goes into tissue, and hopefully you don't hurt him.
No problem.
Cool. So we're going to see some acupuncture, you actually putting it in. Tell us, just let us know where we're going to do it and what we're going to do and how we're going to do it.
Okay, so what I'm going to do is identify the location of the point that I want to needle. And in this instance, we're going to needle what's called the upper trapezius muscles here. So this is the trapezius muscle, runs up to the base of the skull here. And sometimes we can get tightness and pain in the shoulder, and it can refer pain up to the neck, up to the head. So it's a very common area that we needle. And so what we're going to do is have a look at the actual structures themselves. So we're going to find the scapula here, which is the shoulder blade. I'm going to slide on over to the edge of the shoulder, and I'll come on over to the middle of the spine there. And I'm going to look at this distance so I can map out where I need to be in the muscle, which is about halfway across that line, upper fibers of the muscle here. And then I'm going to just palpate and feel these fibers so I can feel the tightness in the muscle there. I'm just going to move along and check for the ribs so I know exactly where I am. And take hold of the muscle very gently, line my needle up. Just going to insert that there, and I'm going to direct that needle down towards my finger so I can control the rate of the needle going in. And that's what it's going to look like there. And this is to treat neck pain, shoulder pain, headaches, and so on. It's a common technique used by a lot of clinicians.
Thanks, Mr. Hobbs. I appreciate that. Thanks for your insight in acupuncture, and I'm pretty sure I'm going to try to summarize everything up before I tell my patients what acupuncture is. So I appreciate that, and thanks for coming. I hope you guys enjoyed that. And Mr. Hobbs, appreciate having you in.
Absolute pleasure. Always good to catch up with you.
Cool.
Always good to work together, and look forward to catching up with some of you guys in the future as well. And pop down to the clinic and get some treatment.
Thanks.